Well, lawmakers battling it out over health insurance reform today, and one of the Republicans proposing an alternative plan to Obamacare is Congressman David Nunes of California, and he joins us now from Capitol Hill. Congressman, I'm all worked up from the conversation we just had about the, the California economy. Is there any good news out there? Can you give us some good news about the state of your state, please?
Well, the good news is that the people of California rejected the bogus proposal that Governor Schwarzenegger and the Democrat legislature put on the table yesterday, and they flat out rejected it because they knew it was bogus. It doesn't solve the long-term sustainability issues of California's economy.
Let's talk about health care then. Let's move on to why you're actually here. What can we do? You know, because again, it's like a microcosm of the overall problem, right? A few people paying for many. Health care and a lot of things are that way now. How do you solve the problem?
Well, what we did today with Senators Coburn and Burr and Congressman Ryan and myself is we introduced a plan that is credible, a credible health care plan. And I challenge the Democrats and other Republicans and anyone else that has a health care proposal to put out a plan that does a couple things. One, that has universal access for all Americans. Two, solves the long-term funding problem of Medicaid and S-CHIP and all the other little government programs that we have that are basically unsustainable at this current rate of growth. And three, gives people the choice of their own doctor and their own health care. And that's the proposal that we put out today. So basically, we're going to treat all Americans the same. Everyone will have the ability to purchase their own health care coverage, and this provides long-term sustainability for our government.
You know, what's that? I was reading an article this morning, I can't remember where it was, so you forgive me, about postalization. Back in 1917, the post office took control of the telephone system briefly, and it worked out dismally. We tried to build steel as a government. That worked out dismally. In other words, the government has never had a good history of running any business. I mean, just ask anybody who goes to the DMV, right? Is that how healthcare is? Is that how healthcare is going to look if this national plan goes through?
Well, healthcare is virtually there already, and what the Obamacare plan is trying to do is basically nationalize the rest of the healthcare industry. They may not call it that, but that's what it is. So currently, if you like standing at the county health clinic and you like standing in line for health care and you're on Medicaid or S-CHIP or anything else, and you want that plan, if you're an American, you want that plan to be your plan, and you like standing in line at the Department of Motor Vehicles, then support the Obamacare plan. If you want a real credible plan, I think that you need to look seriously at this alternative that we call the Patient's Choice Act.
Well, we'll take a look at it because, hey, to be honest with you, Medicare is really like a private business already, right? Is it not, Congressman? I mean, aside from being funded by the taxpayer, everything else is the same. And we see a lot of hospitals and doctors going off it because it pays under what they want. So someone's got to make up the difference.
Right. Well, what we try to stay away from, what we do stay away from, this is really revolutionary for an idea here, because what we are doing is we give anyone from childbirth all the way to the time they get on Medicare, we give them a credible plan and a credible option for them to get health care coverage and be able to choose their own doctor. The way that we're headed in Washington today, no matter how they slice it, no matter what they say, it's taking basically a big broken government program and making it bigger. So it's going to be like adding fuel on the fire. And so this plan gets away from that. It's in stark contrast to the rest of the plans that are out there. And we hope, that's why we introduced it today in writing. We actually have a plan because we want the American people to be able to see that there are other opportunities for them to have success in this
Is that on your website? Where can people read that, Congressman?
It's out there now, yes, on my website, nunes.house.gov. It's there, and we'll get a copy of it because we're going to be rolling this out over the course of the next month.
Thank you. And maybe we can combine the DMV and the hospitals then, and we'll save on real estate costs. Congressman Devin, don't do that. I'm just kidding. Devin Nunes of California. Thank you, Congressman.
Thank you.